Welcome back to the deep dive. Today we're tackling something a lot of us have probably experienced. That frustrating feeling of gaining weight even when you feel like you're doing everything right. We're going to unpack some really interesting insights from Optimal Clinic USA. You might remember them from our previous deep dive where we touched on their approach to online healthcare in California.
Right, covering things like hormone therapy, hair loss, that kind of telehealth service.
Exactly. So this time, our mission is really to explore their focus on medical weight loss. If you've ever felt completely stuck with your weight, even with healthy habits, this one's definitely for you. Okay, so let's dive in. The material from Optimal Clinic USA really pushes back on the idea that weight gain is purely about willpower.
Mhm.
It suggests there's often more going on under the surface. So what are these less obvious factors they talk about?
Well, what's fascinating, what the clinic really emphasizes are these hidden internal imbalances.
Yeah.
They point to things like hormonal disruptions, insulin resistance, maybe thyroid issues that slow everything down.
Okay, so biological roadblocks, basically.
Precisely. And it's not just hormones. They also mention how metabolism can naturally slow with age,
Hmm.
genetics playing a role, even certain medications. And then there's the impacts of chronic stress or just not getting enough good sleep. That can lead to emotional eating, sure, but also direct biological changes.
Right.
It really shifts the blame, you could say, from feeling like a personal failure to seeing it as a biological challenge. They often link it to underlying medical stuff like PCOS, hypothyroidism, or that insulin resistance we mentioned.
That makes so much sense. It connects a lot of dots people might be experiencing separately. So if someone listening is dealing with these hidden issues, what are the signs, the silent signals they should maybe pay attention to?
That's a really important question. The sources highlight key symptoms, things like constant fatigue that you just can't shake.
More than just being tired.
Exactly.
Yeah.
Or gaining weight when your lifestyle hasn't really changed. Brain fog's another big one. Mood swings,
Yeah.
poor sleep quality, even things like irregular cycles for women,
Mm-hmm.
or joint pain. These aren't just random annoyances.
Okay.
They could point to deeper metabolic or hormonal problems.
Yeah.
That's why Optimal Clinic really advocates for like a full body approach, looking at the whole system.
Right, not just calories in, calories out. It's about how your body is actually processing things.
Oh, got it.
Okay, so this is where it gets really interesting. Optimal Clinic USA talks about a two-part approach. Can you walk us through that? How they combine the natural strategies with more advanced medical treatments?
Yeah, absolutely. They definitely emphasize starting with the foundations. Clean eating, nutrient-dense foods, gentle daily movement, even just walking.
The basics we all know are important.
Right. Plus stress management, like meditation or just getting outside. And crucially, hydration and good quality sleep. Those directly impact fat storage, apparently. But here's the key thing they acknowledge. For a lot of people, these natural steps, even done perfectly, aren't quite enough to overcome deeper issues.
Right, that's the frustrating part for so many. So when those foundational habits need backup, how do their medical weight loss programs actually help?
This is where their personalized science backside comes in. They detail about 5 key areas. First, there are FDA-approved weight loss medications, things like Semaglutide or Tirzepatide.
We hear a lot about those lately.
We do. They work mainly by helping regulate appetite and improving how your body responds to insulin. Second, hormone replacement therapy, or HRT, but specifically targeted for patients where diagnosed hormonal imbalances are actually blocking fat loss.
So addressing a specific root cause there?
Exactly. Third, they offer comprehensive medical weight management plans. These aren't just pills. They include lab tests, doctor consultations, meal planning support, and regular check-ins. It's very hands-on.
Okay, full program.
Fourth, things like fat-burning injections. You might have heard of B12 shots for energy. They also use MIC and other lipotropic blends, specific compounds designed to help boost metabolism and energy. And fifth, there's peptide therapy. This is a bit more advanced, aiming to stimulate your body's natural growth hormone, which can help with burning fat and maintaining muscle.
Wow, that's quite a range of options.
It is. And the clinic stresses that every option is doctor-led, it's safe, and it's tailored. It's not a one-size-fits-all approach. It's based on your specific biology and goals.
So looking at the bigger picture then, what really stands out to you about why Optimal Clinic USA feels their approach is trustworthy, especially for folks maybe in California looking for help?
Well, connecting the dots from their materials, I think their main point of differentiation is really tackling the root cause. They're not just aiming for a quick fix number on the scale, but addressing why the weight gain is happening.
Right, the underlying biology.
Exactly. Plus, they emphasize the ongoing support throughout the whole process. It's a journey, not just a prescription. And they aim for lasting results. They also highlight their virtual care model, making it accessible and, discreet across places like San Diego, Orange County, and Riverside.
That accessibility is key.
hmm And the fact that prescriptions come from U.S. licensed pharmacies adds that layer of trust and safety.
This whole deep dive into Optimal Clinic USA's approach to medical weight loss, it really does reframe the challenge, doesn't it? It suggests that maybe you don't have to keep guessing or blaming yourself. There's guidance available.
It really does. And it leaves you with a powerful question, I think. What if your weight loss journey doesn't have to be this constant, exhausting battle of willpower? What if it's actually about understanding your unique body chemistry and finding tailored, science-backed solutions that genuinely work for you?
It sounds like real solutions for real people aiming for real results.
Definitely something to watch.
We'll catch you on the next deep dive.